Hello and assalamu alaikum, ladies and gentlemen. Welcome to yet another episode of the Dental Talk. If you like our channel, please subscribe, please share, please like our videos. It would mean a lot to us. Now, moving on to the dental personality that we have. She's not a dental personality, ladies and gentlemen, per se. She did her electrical engineering from GIKI. So she's our first ever non-dental personality that we have on this show. And it is my utmost pleasure to introduce to you Dr. Wardah Inam. Now, most of you probably don't know Dr. Wardah Inam, so I'll have to introduce you to her. And I tried memorizing her whole intro and I couldn't, so I'll have to read it out for you. She did her bachelor's from GIKI in 2010. She went with the focus on autonomous robots. She then went on to do her master's from MIT in electrical engineering. She did a number of select courses at Harvard Business School, and then she went for her Ph.D. at MIT again in electrical engineering and computer sciences. She has interned at multinational organizations like GE and Apple during the start of her career. She is the co-founder of Ulink Technologies, where they developed the first artificial intelligence-driven operating system of an autonomous and fully distributed microgrid. She is the lead product manager at QBio, another medical technology startup, and then she co-founded and is the current CEO of the company Overjet. And that is what we are here to talk about, ladies and gentlemen. Overjet is a company founded by her. She takes us through a journey of how and why one visit to a dental clinic made her find this company and then change a whole aspect of dentistry altogether. Her groundbreaking research in the use of artificial intelligence in dental imaging has taken the dental world by absolute storm, and we as Pakistanis are only proud of her. Absolutely. So I'm sure you would want to know how artificial intelligence will be used in the future in dentistry, and that's what we promised you to tell you about the advent of technology and how they are automating a good diagnostic part of our profession. So without further ado, ladies and gentlemen, Dr. Wardah Inam. Hello and assalamu alaikum, Dr. Wardah. How are you?
I'm good. And how are you?
I'm good, alhamdulillah. How's the quarantine life going? Not so much anymore. It's getting better, but how was it? How's it been the past few months?
So at least in Boston, it's still it's still work from home, and limited activity.
Yeah.
So I think the quarantine life is still going on for
Okay.
us at least. But hopefully, things are getting a little better. Hopefully, the cases don't spike too much, but
Hopefully.
things are at least we're getting used to it.
Yeah. Everyone's getting used to it. Okay. So with your permission, should we start the interview?
Sure.
Okay, so let's talk a bit about you. How about you introduce yourself to our audience? Tell us a little bit about your journey in GIKI and what made you pursue a master's in the United States.
So for me, I went to GIK primarily because I was interested in engineering. So I was interested in physics, math, and trying to build something. Was very interested in robotics,
Yeah.
and asked my sister, who was a few years older than me, what do I do if I'm interested in robotics and physics and math? And she asked her friends, and they looked at different engineering types and thought that electrical engineering might be the right approach for me. So ended up working or pursuing that during undergrad, and ended up at GIK, which is an interesting university on its own, siloed from the rest of
Absolutely.
Pakistan in a way. But during that time, got really interested in engineering and what it held, the possibilities that it held for building stuff, solving problems, and that's why I even applied for future studies. So ended up doing electrical engineering and computer science at MIT, and applied for my master's.
Perfect. That's a beautiful story. Okay, you've worked a lot in artificial intelligence, AI. Where did that passion come from? And did going to the United States and studying at universities like Harvard and MIT add to that passion in artificial intelligence?
I think, I think my major passion is solving problems. And artificial intelligence or smart systems is
Yeah.
something that I was always interested in, and that's what I applied for when I was actually, applying for my, um, uh, you know, higher studies as well.
Yeah.
So even during undergrad, I was very interested in more autonomous systems. So
Hmm.
I worked on autonomous robotics, which
Yeah.
is, machines being smart enough to do things for
Yeah.
you. And I
Absolutely.
think that helps you solve some of the problems which have not been solved before, and that's been my interest towards it. And as especially now, because of what's happened in deep learning,
Yeah.
as well as computer vision, there's a lot of opportunity in applying these technologies in solving real problems such as healthcare and especially dentistry.
Absolutely.
But that's been my interest so far.
Absolutely. Okay. So now let's come to the dental side of it. Let's come to Overjet. Now, you co-founded this project. You were the CEO of the company. Let's have a brief description of what your company is and about what groundbreaking research that you've done that has taken dentistry by storm.
So, what the company is about is using artificial intelligence, primarily computer vision and deep learning, to analyze dental clinical data. So, rather than just what we've seen in the past is financial data being analyzed and decisions being made based on the financial data, but never having an ability to analyze clinical data. So, what I mean by clinical data is the X-rays, the notes, etc., that the dentist takes, and that helps them in making their diagnosis, etc. Now, more so, at least in the US, a lot of imaging is happening as well.
Yeah.
So intraoral imaging and scans. So we're collecting a lot of this information
Yep.
and being able to analyze this information not only at a one patient level, but actually at a practice level, or at millions of data level, gives you an ability to start identifying not only risk at the patient level, but also trends, etc., at a population level. So we've been working with Harvard and other institutions in looking at oral health, or effects on systemic health. So how does diabetes relate with
Hmm.
period disease, etc. So, a lot has been studied in this space, but
Yep.
it has been studied taking very little data. And now that we have this ability to analyze clinical data at scale, we can actually do some of these studies. So to answer your question of what is groundbreaking about it, I think what we did was we tried to encode dentist understanding of disease as well as treatments into models, and these models are repeatable, robust, and accurate. And once we have that, then we can use those models to analyze
Hmm.
clinical data at different levels to provide insights to the not only the dentists but also the managers of these organizations.
Okay. So in layman terms, so so that everyone can understand, it's basically a software. Can we call it a software?
Yes.
Okay. So it's a software we can input data and it can tell us a treatment plan. Is that how it goes, or am I correct me if I'm wrong?
Yeah, so absolutely. So it's basically a software which can tell you what treatments are necessary and what are not. So as you said, the treatment plan itself. So what we can do is look at a patient's information that is present and say, do they need a cavity? So do they have a cavity? Do they need a filling?
Yeah.
Yeah. Or do they have periodontal disease and they require scaling and root planing? So there's this ability to go from the disease to actual treatments. And again, that's something that if you look at what's happening in artificial intelligence right now, even
Yeah.
if you look at the healthcare side,
Yeah.
a lot has to do with diagnosis. So
Absolutely.
can we diagnose the underlying condition? So in this case, it will be, can we see if there's a cavity or not? But what we are able to do is kind of go beyond that. And we're able to say, okay, if, there is a cavity, how big is that cavity? As you know, being a dentist, that the
Yeah.
treatment plan that you do really has to do with the extent of that disease. For a very
Yeah.
small decay or cavity, filling might be enough, but for, say, if
Absolutely.
it extended to the pulp, now a root
Yeah.
canal might be needed. So being able to not only determine or diagnose the disease, but also determine the extent of that disease, and then how it relates with the anatomy lets us determine what treatments are needed and what treatments have been missed, etc. as well. So not only we can look at prospectively, but also retrospectively and see what should have been done and was not done.
Beautiful, beautiful. Now, where did this idea specifically of a dental imaging artificial intelligence software come from? And what are your plans, if any, of expanding this horizon in the future?
So for me, it actually was a personal story. I went to the dentist, and I had gone to a few dentists, and I changed my dentist basically. And so I went to what's called a chain clinic. So there, multiple clinics under an umbrella. And the attending dentist basically gave me a treatment plan, which was consisting of multiple treatments. I think it was 7 or 8 treatments, and I had before that I had never received anything like that. So first I was a little fearful of what really happened, and I need to get these treatments. But when I started looking at it, I started Googling, how do you read x-rays. I'd ask them to give me my x-rays and started reading about it. It seemed very aggressive to me what the dentist was suggesting. So I took my x-rays, gave it to a few dentists. I actually gave it to a few dentists in Pakistan as well, and some here, and said, hey, what do you guys think? And what I realized was that there was a lot of variation. So first, there was not only first, like everybody disagreed with that particular dentist, but then there was a lot in what should be done, and that's where we realized that underlying, if you look at it, there is an art to dentistry, which is probably the way you create a crown, etc. But the diagnosis piece is not an art; it's a science. And how do you actually look at it as a science, and how do you use the best minds that exist and take their understanding of disease and encode that, right? So that's how it kind of came about. And one of my friends who was basically, he was at MIT before and then had gone to Harvard Dental School. He had just graduated, and I started talking to him about what was his experience and what does he think as well. And we together started thinking about he was of the same opinion. Even in dental school, going from one professor to another, he was getting different
absolutely,
it was taught differently. So I think that's where we came about of like, hey, can we actually use artificial intelligence to aid dentists in making their diagnosis better, but also in improving patient care at the end.
Wow, that is actually amazing. That's something I did not even think of, that you're standardizing a treatment plan, because it's true. Even over here, we go from teacher to teacher, and one professor has one treatment plan and another professor would have, in the same clinic, would have a different treatment plan, and you've standardized that. So that's absolutely brilliant.
And as you can tell with this treatment plan as well, there might be different inputs that you can put there, right? So it doesn't have to be that, there's going to be only one treatment plan. But the thing is, what are you trying to optimize here, right? Are you trying to optimize for treatments not happening when they don't need to happen? Are you trying to optimize for cost? Are you trying to optimize for inconvenience? And those can be parameters that the patient can be taken into account for. And of course, people have different opinions on how they want to be treated as well. But having this ability to standardize it such that at least, whether you're going to say a rural village or you're going to a very posh area, you should be getting the same treatment.
Okay, perfect. Okay, so now it's obviously the way one looks at it, but did you have to face any kind of backlash from the dental community? Because since this software or technology is automating a great part of a dentist's workload, so if any, was there any backlash?
I don't know if there was backlash, but I think the first few dentists I talked to were basically, the first dentist I talked to, they said, it doesn't really work in dentistry because of X, Y, and Z reasons. And, they had their reasons, but it wasn't because, you automate some of my tasks. The interesting thing about dentistry is, apart from radiology, so where has, this technology really, in healthcare really proven itself is in radiology.
Yep,
There, you're actually replacing what a radiologist's job is. But if you think of, and you probably, if you think about yourself, you think of yourself as a radiologist or more as a surgeon.
absolutely.
And most dentists we talk to, it's more, they think of them as a surgeon who also does radiology, rather than the radiologist who's also doing surgery. And I think that's the difference. And I think that's why it's being accepted this well as well, is because it's not a threat to them. Like, this cannot replace a dentist at all. This is a very small piece of or at least length of time that the dentist spends looking at the data itself. But it actually helps them. If even in your environment, a dental, there's it's a very fast-paced environment. You have to go from one procedure to another very, very quickly. So you have very little time to analyze that data too. So having technology which can help you do that is useful. And I think then, so I talked to a few dentists, and then I met a dentist who was he was actually he's from Pakistan as well, Dr. Fahim Rasool. He was head of prosthodontics at Harvard Dental School before, and has many like really good practices in Boston. And I talked to him, and he was he got it like instantly. He's like, okay, you guys are creating a standard of care in dentistry, which hasn't kind of existed before. You're talking about evidence-based dentistry, which has been a dream for for people for many, many years, and this is the way to move towards that. So I think there was some like negative, there was also positive, and whenever you start something new, even probably when you're thinking of the podcast, there might be people saying it won't work or it would work. So basically believing in what you want to do and going with it.
Beautiful. Okay, now let's come to Pakistan. Can this software, a software like this, be implemented or used in a third world country like Pakistan, where dentists are already scarce for the majority of the population? And if it can be implemented, how so, and to what magnitude exactly?
I think where it will come into play is two areas. That's at least my understanding. It might change over time, but one is, as we discussed earlier, intraoral images are becoming a major piece of it. So when we talk about more rural areas, etc., it's going to be more the ability of your phone to take an image and being able to see whether it's severe or not. At least the thing with very severe cases is interproximal caries you won't be able to get, but if if it's a very severe case, you're going to detect it at least even just using your phone. So having that ability to take an image, analyze that image, can enable at least basic care in these rural areas. I think that would be one area where this kind of technology will help. Second would be in the higher end area, which is the cone beam CT or the CBCT area. So if you look at the CBCTs, which are like a 3D X-ray of your mouth, we in Pakistan, and you can correct me if if you know some people there, but oral radiologist is a scarcity in Pakistan. Over even in the US, there are about 200 oral radiologists. So it's not a big there are not that many oral radiologists in general, but in Pakistan in general, there are Pakistanis who are oral radiologists, but oral radiologists practicing in Pakistan is limited, and that's where oral radiologists are the ones who do the reading of cone beam CTs, and that's somewhere where this technology can help as well. So I would say I will probably start with the completely low cost as well as that high cost treatment as well, and then probably work its way towards the middle area.
Perfect. Okay, so now we have a pandemic going on right now in the world. Considering this COVID-19 situation and how there's this aura of uncertainty among the dental professionals, and how will dentistry get back on its feet, your software can be absolutely game-changing for so many dentists at a commercial level. What are your comments or plans regarding this?
So at least how we see it is, or what our software allows is a comprehensive care.
Mhm.
So
Absolutely.
if you think about at least dentistry in the US, it's about, you get a say a filling in one appointment, and then another appointment will be set after 6 months or so, or a few months, and the amount of time that the dentist is spending on a patient is actually very small, and then they're seeing a lot of patients in that day. We
Absolutely.
believe that, especially when it comes to how dentistry has changed because of COVID, is the ability to change patients or go between patients has reduced.
Absolutely.
And what you need to do is look at the patient comprehensively and see how many treatments can be done in one go, rather than breaking it down into multiple
Absolutely.
treatments,
Yep.
as well as being able to take some time to explain, and the software allows you to explain some of these your what you're seeing on these x-rays, etc., to the dentist, to the
Absolutely.
patient as well.
Yep.
And now that you have that time, you can actually use it for visualizations, better explaining to the patients. And what we've seen is, whether it was with the intraoral cameras, the more the patient knows about their health condition, the more likely they're going
Absolutely.
to
Yep.
make the right decisions as well, and actually do the treatments, because
Perfect.
treatment acceptance rate is a challenge in
Yep.
dentistry.
Yep. Absolutely. Perfect. Okay. Now, when in Pakistan, let's talk a bit about Pakistani dentists. In Pakistan, when a person graduates from dental school and he's young, there are there's a two focused approach, a dual focused approach, I should say, where a person either they go towards academics or they go towards private practice, and those are the only two focused approaches that a student can look into. But we know that there are other things within dentistry where a person can also work upon, such as technological advancements, forensic dentistry, and there are many other uncommon places in dentistry where a person can specialize. And you've obviously met such dental personnel who are working with you. What would your advice be to young dentists in Pakistan who don't want to go into academics, don't want to go into private practice, and want to pursue dental technology as such?
So dental technology, and I would say dental technology and dental research in
Yeah.
general, is fairly limited.
Yep.
Just because of historical reasons, when healthcare got separate from dentistry in general, you've had because you've not had big pharma money, etc. You've had you know uh, research being limited. So I don't
Yep.
think it's just a Pakistani problem. I
Yep.
think it's all across the world. But I think the it's I would say because of that there are limitations. However, now with these technologies getting developed, etc., there is an ability to do like remote work as well.
Yeah.
We have about now 80 dentists that we employ, who are looking at data, analyzing data, etc.,
Okay.
for us. But I think there is a whole spectrum there that exists. And then the other is like, if you're interested in like business, then there you can, you don't have to be the practicing dentist. You can start
Yeah.
owning clinics as well.
Absolutely.
In Pakistan, there is no a major dental service organization that
Hmm.
exists which can actually provide care across
Absolutely.
different organizations. So I think there's a lot of opportunity in terms
Hmm.
of by knowing dentistry, you're
Yep.
at an advantage to provide value in the dental industry, whether it is towards practicing, but also
Hmm.
uh, improving the care of delivery that exists as well.
Perfect. Okay. Now, you're a true inspiration for so many women in Pakistan. We have to talk about that because when this news came out that there was this link that was being forwarded everywhere in Pakistan to these WhatsApp groups, and we were getting this information that about Overjet and how you were the CEO. What advice would you give to women in Pakistan who want to pursue their careers in any field, not just in dentistry, and how to have that work and family life balance? What would your advice be to young women? And this question is coming from my team.
Now, I think, especially now,
Yeah.
when we talk about like software, right? I think we have this unique opportunity, especially like women in general, to actually be able to, if they cannot actually, work in a, or they have to work from home, etc. It gives you that flexibility, and it's
Yeah,
probably the most valued skill set that you can have
absolutely.
compared to anything else. So I think I would say like building skills in areas that you can actually which work with you in different environments as well would be, I think, a good strategy at least.
Hmm.
Not everybody will become a software engineer, but thinking in terms of what are the
Yeah,
skills that I can acquire that let me, first, if you're a software engineer, you can actually operate in any industry you want.
absolutely.
Every industry requires software engineers, so it lets you that flexibility, like horizontally, but then also like flexibility in terms of your how you want to uh,
Absolutely.
do the work as well, whether it's doing it as a freelancer, or whether it's doing it joining an organization. But building skills, I think, is very important, and being good at something. So not
Absolutely.
trying to do 100 things, but being able to learn something where you can add value, and once you can add value, there's a monetary always a compensation associated with that
Yeah,
as well. So I would say, thinking, there are some, I've been fortunate where I don't have those kind of limitations, but a lot of people in Pakistan have very serious limitations. And I think looking at areas where they can excel, whatever that limitations might be, I think that might be at least a good way to start.
absolutely. Perfect. Okay. So my last question, Dr. Varda, what do you think about this startup of ours? And since you've been a CEO of so many startups, any advice that you would like to give us?
I think, with anything you're starting or doing, there's a lot of work.
Yeah.
So you have to do a lot of work in the beginning, especially before. There's a lot of I would say you're pushing a lot of things. It's not, things are not being pulled in a way. Like
Yeah,
you need to get to a point where people understand what you're
absolutely.
doing. You need to get to a point where people know what you're doing, and to get to
Absolutely.
that point, it takes a lot of effort, as well as there's a high and lows, in
Absolutely.
general. So I think they're being aware of those, I think, is very important, and making sure that you surround yourself with uh, with people who are supportive of what
Supportive.
you're doing,
Absolutely.
rather than not. So I think that would be my piece of advice for anybody who's trying to start something
Perfect.
new, to just continue.
Yeah.
It gets easier with time, but the first, getting that ball rolling takes some
Yeah.
time.
Perfect. Perfect. Thank you so much, Dr. Varda, for taking time out for us. It meant so much to me and my team. It was really an honor.
No, thank you so much. Thank you for having me.
And best of luck for all of your future endeavors. Take care and stay safe.